I'm Gabby Karatko, first semester nursing student. Today's date is November 8th, and I will be demonstrating Naso Suctioning. So I'm going to first go ahead and assess my patient to make sure that there's an actual order and a reason for the order. Reasonings as far as the O2 stats being low, maybe change in color, or excess secretions being noticed. After that, I will gather all of my equipment and head into my patient's room, performing hand hygiene. Good morning, Miss Jones. I'm Gabby, your student nurse today. Today I'm going to be going ahead and doing some Naso Suctioning. Is that all right with you? Okay, perfect. So what's your name and date of birth? Awesome, thank you. I provided for privacy already, so now I'm going to go ahead and lift up the bed to a working position, keeping her in semi-fallers. Right, and I'm going to go ahead and apply my cleaning gloves and hyperoxygenate. So turn up the oxygen on the wall. And I'm also going to go ahead and test my suctioning, turning my suctioning on to 80 to 120. Okay, good. And lastly, apply a towel in case there's excess secretions that fall out. And if my patient does become sick, I'll place a basin for her as well. So now I'm going to take off my gloves, hand hygiene one more time, and I can open up my kit now. Dump some sterile water into my basin here. And open up my kit. Starting with my dominant hand, applying my sterile gloves. And now I am sterile, so I can go ahead and touch my tubing. Take it out. Wrapping with my non-dominant hand, I will then go ahead and measure from nose to the ear, down to the neck, which is about 28. So after that, I'm going to break sterility with my non-dominant hand by touching the suctioning tube, applying it to my sterile tube here. Test suctioning again. Go ahead and lubricate my tube a little bit. Still testing that suctioning. And now I'm going to go ahead and take off her oxygen and enter the tube in, 28 inches. With my thumb off of the suctioning. Once I've reached there, I'll go ahead and place my thumb on and in a circular motion, start to pull out my tube. Okay. Apply oxygen again in between passes. So then I will go ahead and re-cleanse my tubing, again checking the suctioning, allowing my patient to hyperoxygenate between passes. And if she's fine, I'll go ahead and take off the oxygen again with my thumb off of the suctioning. I will enter it in her nose again, 28 inches. Place my thumb on the suctioning and circular motion outward, not lasting any more than 15 seconds. Oxygenate again. And I'll encourage my patient to cough and deep breathe as needed. And if I've noticed that she's fine and doesn't need another pass, I can go ahead and disconnect my tubing. Turn off, so I'm not sterile anymore, so I'll turn off my suctioning as well as decrease my O2. Perform hand hygiene again. and I will document any relative data.